My name is Natalie Frazier, and the drug that I chose is Bupropion. The generic name of Bupropion is Wellbutrin. So what is it used for? Bupropion is an antidepressant, but more specifically, it's a norepinephrine dopamine reuptake inhibitor. This means that it blocks the synaptic reuptake of norepinephrine and dopamine. There are no serotonergic activities, so it does not cause sexual dysfunction side effects, which is different than most antidepressants because most antidepressants do cause sexual dysfunction. Specifically, Bupropion treats depression and seasonal affective disorder, or SAD. However, it also has some unlabeled uses and just other uses in general. It's used as a smoking deterrent, so for smoking cessation, and it is also used to treat ADHD in adults. So it has many uses, but the main use is that it's an antidepressant. The preferred route of administration for Bupropion is oral, so it comes in the form of tablets. There are 3 different types of tablets that require different administration schedules. So first is the regular tablet, which should be taken either 3 times daily every 6 hours or 4 times daily every 4 hours. Then there's the sustained release tablet, which is taken twice daily every 8 hours. And then it's the extended release tablet, which is taken once daily in the morning and taken 24 hours apart. For seasonal affective disorder, because it occurs only during a certain amount of months, there's a different administration schedule. So they should be taken once daily in the morning and begin taking in the early fall, continue through winter, and stop in early spring, because the winter months are usually when seasonal affective disorder occurs. Continuing on with dosage and administration, there are a few key points that patients should know before taking the medication. They should know that they should take the medication with food to prevent any GI upset. They should not take it close to bedtime. They should take it around the same time every day, and that they take it exactly as directed and prescribed. They should not crush or chew the tablets. They should instead swallow them whole. They should be told that it takes up to 4 weeks for the drug to reach the full therapeutic effect. And they should know that they should not stop taking Bupropion without talking to their doctor, because the doctor may gradually decrease and discontinue the medication. They should never directly or abruptly stop taking the medication. As with every other medication, Bupropion does have common side effects. These side effects may include insomnia, tremors, anorexia, anxiety, weight loss, dry mouth, dizziness, nausea and vomiting, sore throat, headache, stomach pain and constipation, excessive sweating, tinnitus, which is ringing in the ears, frequent urination, and drowsiness. There are also a few adverse effects that patients should be aware of, and that they should know that if they do experience any of these adverse effects, they should stop taking the medication and call their doctor. These adverse effects may include seizures, hallucinations, muscle or joint pain, rapid or irregular heartbeat, hives or rash, difficulty breathing or swallowing, chest pain, swelling of the face, throat, feet, just anywhere really on the body, changes in eyesight, and homicidal or suicidal thoughts or behavior. Because Bupropion causes seizures as an adverse effect, patients with seizure disorder or patients undergoing an abrupt discontinuation of alcohol or sedatives should not take this drug because of the potential of seizures. Patients with a current or prior diagnosis of bulimia or anorexia nervosa are also contraindicated with taking this drug, and patients that are currently taking or had recently taken an MAOI in the past 14 days or 2 weeks should not take this drug, because there is a serious drug-to-drug interaction between MAOIs and Bupropion. Caution should be taken with patients taking this drug that have a history of heart attack, head injury, high blood pressure, diabetes, or liver, heart, or kidney disease. Patients should know that they should not drive a car or operate heavy machinery while taking this drug. And patients should also understand that Bupropion may cause angle closure, glaucoma, and that they should have an eye examination before starting this drug. There are a few key points that nurses should teach a patient before taking bupropion. So first and foremost, probably one of the most important things is that the patient should know not to abruptly stop taking the medication unless otherwise instructed by their doctor. And this is because if they abruptly stop taking the medication, it may cause some serious adverse effects. The patient should also understand that they need to call their doctor if they have suicidal or homicidal thoughts, and that they should consult their doctor before beginning any new over-the-counter medications or herbal remedies, because there may be some drug-to-drug interaction that the patient is unaware of. The patient should know to tell all of their healthcare providers that they're taking bupropion, and this is because there may be some drug-to-drug interactions within other healthcare settings if the patient does not tell their other healthcare providers. The patient should also tell the doctor if they're pregnant, plan to become pregnant, or breastfeeding, because bupropion is contraindicated in lactation and pregnancy. Also, another very important point is that patients should understand that if they miss a dose, they can either take the dose immediately unless the next scheduled dose is soon, then they should skip the missed dose. This is because they should never take more than one dose at once, because it can cause toxicity or overdose.